I learned on the internet that probably the disease was about a 15-year disease. If I did nothing 15 years from now, I would be dead. And I really wasn't prepared for that.
4 years ago, I was diagnosed with prostate cancer after many years of doing annual PSA exams. And the PSA exams revealed that I had a high level, and that was closely monitored by my doctor, Dr. Waldman. Because I have a family history of prostate cancer, and my father passed away from prostate cancer 8 years ago.
When I was 45, I had a friend had a problem with cancer, and he made a suggestion to me before he died. And so when I was 45, I started getting a PSA exam every other year. And I did that till the time I was 50. And then at 50, I decided I probably should go every year. Then just before I was like 53 and a half, I went and had another annual. And that's when they found my prostate cancer.
There were a couple of things that kind of moved me to get something done. One is that my stepfather-in-law died of prostate cancer, and he had made the decision to do nothing. And when he died, he weighed 95 pounds.
Probably 1 in 100,000 to 1 in 200,000 will be diagnosed yearly. It's about 1 in 6 men will be diagnosed with prostate cancer in America. Prostate cancer in most of the studies is the #1 or #2 cancer killer of men in America. So it's the real deal.
Personally, I think surgery when you're dealing with cancer is the sure answer. May not be a nice answer, but I think if you want to rid yourself of the disease, and that was my goal, surgery is the most effective way to do that.
In general, when we are evaluating patients with prostate cancer and discussing with them treatment options, the factors that influence what we talk to them about are, one, the patient's life expectancy. A young, healthy guy who's in his 40s, 50s, 60s, who doesn't have other significant health problems is likely to live another 20 or 30 years. Those patients, their prostate cancer, if untreated, is likely to shorten their life.
After the results of the cancer test, and I met with Dr. Waldman, he sat me down and we talked about the various options that were available to me, which were the old standard surgery, radiation, seeds, I think were part of that. And then he mentioned a new procedure that he was using a Vinci robot, which I had no idea what that was.
When I was at the other doctor, with his procedure that he had recommended for me, it was more of the conventional type of surgery, what they've done in years past. And he said you'd have to go give blood because I would have quite a bit of loss of blood. I went to get a second opinion. A friend of mine recommended Dr. David B. Rice. When I went to Dr. Rice had told me about this one procedure that they did at St. Al's with a Da Vinci.
Of course, with any new technology, there's been a lot of debate. And one of the things is that as the surgeon, I can just see better.
From a purely selfish standpoint, I'm a lot more comfortable during the operation because I'm seated the whole time. For less selfish reasons, the Da Vinci makes me a better surgeon.
There are a number of positives about the Da Vinci. And one of the positives is that it's 3D vision. It's just like I'm looking at you. And so you have better depth perception. The robot itself gives you exquisite control and precision with the instruments. It's magnified 10 times. There's less blood in the field.
I'd do a better operation for the patient than I would with either standard laparoscopic prostatectomy or with open prostatectomy.
And then the benefits to the patient, less blood loss, less pain, smaller incisions, quicker recovery.
And the instrumentation allows you to be a lot more precise with what you're doing and being able to make maneuvers that are millimeters different instead of centimeters.
And as I researched the Da Vinci machine itself, I found a lot of confirmation that the recovery times were quicker, The side effects were less, and it looked to me like it was probably the direction to go.
So after researching the alternatives and studying the different methods of trying to get rid of my cancer, I opted for the Da Vinci method. And the reason I chose that is because I have a very active lifestyle, and I wanted to be able to continue the life as I knew it. We scheduled the surgery, went to St. Al's. They did the pre-checks, the post-checks, did the normal work that happens before you have surgery. And that all was very, very smooth. And the surgery went very smooth. I went in at 6 o'clock or 7 o'clock on a Monday morning, and I was home at noon on a Tuesday morning.
I guess the one thing I'd say too on my procedure with St. Al's is that the staff there was very kind to me. I was very comfortable after the whole procedure, so I'm very satisfied with St. Al's.
They were really sweet to me when they brought me in, and everybody from the surgical team and everybody that I was going to deal with came in, introduced themselves, and had at least a short conversation with me. Also, the nursing staff was extremely attentive for me here at St. Al's. They made sure I had anything that I wanted.
I only had to stay 2 days, so I really did have a lot faster recovery right away off the bat. I got to go home soon.
We started using Da Vinci here at St. Alphonsus in 2003 for prostates. Today is a different era. Back then it was really new, and we were on the forefront. I think we had the 60th robot in the world here at St. Alphonsus.
I was actually surprised at how well I felt. I'd actually arranged for time off at work and found myself thinking, I guess it's time to go to work. So my recovery is really faster and better than what I had expected, because I walked in there anticipating the worst and came out saying, wow, I'm glad I did what I did.
Some of the longer term side effects, he said it could affect your sexual performance, and there are things that we can do to help that. You may have an incontinent problem to some extent, and we have ways of dealing with that. To my surprise, I didn't have any of these problems.
Probably the single most important factor in determining surgical outcomes with prostatectomy is surgeon experience.
We've done here at St. Alphonsus between 800 and 1,000 prostatectomies.
I don't know that we have the most experience in the Northwest with robotic prostatectomy, but we're definitely in the top 2 or 3 here at St. Alphonsus because it's been here for so long.
And as time has gone on over these last 7 years, and you know, my skills have gotten better. The team here at St. Alphonsus has become more cohesive and more fluid.
It took me about 6 months to get feeling back to the old me again, which was being an active person. And that enabled me to do all the things that I had done before surgery, which includes rafting, skiing, flying, golfing, weightlifting, running. So I lead an active lifestyle, and it hasn't slowed me down a bit in any of those activities.
Well, and as far as life after my prostate, it's great. It's back to the way it always was. I'm able to go out and enjoy people like I'm around, and my cattle, and my wife, and my life is just back to where it was always at. And you know, I told Doc one time, one of my visits, I said, you know, Doc, I said, I don't even miss my prostate.
There's been a lot of press lately that you don't need to treat it, that it really does no harm. And again, the statistics would speak against that. And the other thing is, if you've ever seen anyone who has had the misfortune to die of prostate cancer, it's a miserable way to die. And it's something that I would wish for all men to avoid.
I still don't see any real alternative. If this were to happen to me again, I would go back to Dr. Waldman, I'd go back to St. Al's. I wouldn't wait on the surgery. I'm very happy with the decisions that I made.